Cool.
Yes. And I'll go ahead and share the agenda in the chat.
We're not speaking.
Eric, just let me know when you want to get started, because I think Michelle and Ruth are going to join us a little later, right?
Yeah.
Okay.
They might not be able to join us, so it'll just
Okay.
be the two of us, and we'll get started in about 1 minute.
Sounds good.
Cool. Just a lot of people still joining. Looks like we got Dr. Locke coming on. All right, welcome everyone. We'll start in just 1 moment. All right, good morning, everyone. Thank you so much for joining the COVID Liaison check-in. Hope you all had a great week, and thank you extra for joining if you are on your spring break. Only 5 more weeks to the end of the school year. Super exciting. Hang in there. Just a few housekeeping notes. This meeting is being recorded, so we'll get that recording out to you as soon as possible, probably by end of day Monday. The latest, so that we can you can pass that around for anyone that wasn't able to make it today. If you have any questions, please put those in the chat, and I will go ahead and copy them over to our agenda, which has our resources linked as well. So I'll go ahead and post that one more time. Okay. And so with that, I'm going to go ahead and pass it off to Lisa, who's going to go over some changes to the guidance, and then we are going to be spending the rest of the time on Q&A. So thank you so much, Lisa.
Thanks, Eric. Welcome, everyone. Good morning. Happy Friday. We don't have a lot to kind of say or present today, so we're going to have a lot of time for questions. but I did want to go through the guidance documents a little more thoroughly than what we did yesterday on the all schools call. Maybe open some of the documents and show you where the changes are so that you can reference them. So I'm just going to share my screen. Oh, Eric, can you give me access to share my screen? Thanks.
Will you give it a go again?
Yeah. Oh, now I can. Cool.
Beautiful.
All right. Can everyone see?
Good.
Great. Okay. So you all are familiar with the teal stars where there are changes. And as you can see, there are a lot. So, and we haven't met for a while too, because of everyone's spring break. So I'm just going to go through pretty quickly, but I'll open a few of these documents. In the state guidance, I wanted to open up the K-12 guidance, which was updated on April 6th to show you the main area that was updated. And as you know, all of the state documents always include these updates here and with a date, which is I find very helpful. So if you go down to the quarantine, the exposure section, which is right here, this is the new number 7. And what I want to point out here is it says right here, schools may consider permitting asymptomatic exposed students. This is the part here, regardless of their COVID vaccination status or location of exposure, to continue to take part in all, K-12 schooling, extracurricular activities. Obviously, this changes if they develop symptoms, which that has always been the case. So the big change here is right here, location of exposure. As you know before, when there was a home exposure, they needed to quarantine at home and not return to school. That is no longer the case. So all students, regardless of location of exposure, can return to school. So that was a big update. And then sections 8 and 9 have been retired. So go ahead and it's in the guidance. Let's see, let me close that right here. Also face covering guidance. As you know, there was a big change this week at the federal level, and the face covering guidance for CDPH now reflects that. So it's now in alignment with CDC's announcement that masking is no longer required on public transportation and transportation hubs, but we are still, CDPH still strongly recommends that individuals in these settings continue to wear a mask. So I wanted to just point that out. Let's see, also this here around isolation and quarantine, and this applies to staff, right? Because students, as you know, can return to school, as I just reviewed. So this is for staff. This is the CDPH guidance for staff, or it applies to staff. And what happened here was on April 6th, they removed the quarantine recommendations for asymptomatic and exposed people. However, Alameda County has not aligned with the state around this yet. Now I'm going to let Joanna, Dr. Locke, talk a little bit more about that. And I'm also going to include our press release in the chat in a minute so that you have that to reference. But yeah, just wanted to point that out. And then here's the playbook. This is for your events like graduation, proms, all of the end of the school year things that are coming up. This is the resource here that you're going to want to read and reference for planning all of those events. I also want to encourage you to take a look at our updated FAQ. This has been updated, I believe it was April 7th. And this just reiterates everything I just went through, but it gets into a little more detail around things. So definitely read through this FAQ. And this has been updated. And we no longer include all of those FAQs. We used to have the FAQs at the back of the guidance document. That's no longer the case. All of our local FAQs are in this document here. So this is pretty important. So definitely take a look at that. I think that was all I wanted. Oh, and maybe we did update the flow charts here to reflect the change to the K-12 guidance that students are able to return to school regardless of the location of exposure. So this is now reflected in the flow chart. And I believe we're going to be looking at the staff flow chart to see if there needs to be changes, but I don't think there needs to be, but we're going to look at those today. And then one last thing here, mask season. So this is a new resource that we put together collaboratively with ACOE, and it has beautiful design. Thank you, ACOE. This is around mask season. So as you know, we are in mask season right now. So we're still recommending masks. It's not a mandate, but it's mask season. So don't put away your masks. You know, we're still recommending that. So that's what this talks about here. And so this will also be translated, I believe. Eric, do you know, have an update on the translations for this one by chance?
I'm sorry, I don't.
Okay, but I do know that it's in the process of being translated. So I think that's it. Dr. Luck, anything I missed in the guidance? Let me stop sharing my screen, sorry.
No, I don't think you missed anything. Did you want me to talk about the general quarantine guidance?
Yes, please. And I'll put that, I'm going to put the press release in the, sorry, there we go. It took me a while to find that button. I'll put the press release in the chat while you're talking about it.
It also,
Okay.
there's a request for the FAQ link directly if you can.
Oh, okay. It's in that guidance document,
It's in
but
the guidance document, yep.
yeah, which you should actually practice looking, finding it there, but I'll link it in the chat.
So CDPH has changed its quarantine guidance now to not, as a state, not require unvaccinated people to quarantine. Our order is staying with quarantine right now. You know, we are seeing a slight uptick in cases. So we didn't feel that it was the, perfect time to be getting rid of quarantine. We're going to be reevaluating that every week. And at some point, you can expect that we will align with the state. But for now, just as before, the state made its change, unvaccinated, the general public who are unvaccinated need to quarantine for 5 days. So that would cover your staff. So teachers and staff would need to follow that rule. Students continue to follow the K-12 and childcare guidance. So students can stay in school once they're exposed, even if they're unvaccinated, no matter where the exposure occurred, and they can continue to attend school and participate in all the school-based activities. The school, of course, or the district is free to be stricter, but in terms of following Alameda County public health guidance, students can be in school, staff who are unvaccinated need to stay home for 5 days. If they are unboosted, they don't, but that has been the case. That has been an exception in the ETS for some time, that unboosted staff could leave quarantine to come to work. So in our order, we only talk about the unvaccinated. We don't talk at all about the unboosted. And I know it's creating confusion, and we understand that, but we align with the state as much as possible, but we always look at what's happening in our county before we just sort of say, we're aligning with the state. And this is one situation where we felt it prudent to delay that alignment for a little bit. Anything else, Lisa, would be helpful? Close contact.
Yeah, maybe you mentioned that. Then there's one other
You're
resource
muted.
I want to share after you're done talking that I forgot to share. Thanks.
Okay. So we also, the state updated their general close contact definition to align with the one that you've seen in the K-12 group contact tracing model, which is to say that you are considered exposed if you shared airspace with somebody for at least 15 minutes during the day. And then that still goes for school because we are 100% following the K-12 guidance for students. So the shared airspace close contact definition holds at school. Outside school, we are continuing the within 6 feet for 15 minutes definition for the time being. For many businesses in particular who have sort of large cavernous offices, it would be sort of onerous to have to, name every single person in the building as a close contact. It's just not super convenient in many settings. So outside of the school setting, the 6 feet definition stays.
All right. Kelly French is asking the press
Sorry,
release.
let me find the right one. Sorry. I was a little too quick. Hold on.
Thank you.
He's got it. It's there.
Okay, thanks. Sorry about that. There was one other resource I wanted to share. Hopefully I can get the right link in here. There we go. That I forgot to mention. It's at the parents page for the Safe Schools for All hub, and I'll put the actual Safe Schools for All hub in the chat as well. But this page is kind of buried on the hub. So I thought I just wanted to share it with you all. There's a lot of really good resources here around testing, how to do home testing, just a lot here that I wanted to, make sure that you all review. And then I'll put the Safe Schools for All overall hub in the chat as well, which I'm sure you all have, but just in case.
Thank you so much. All right. Question from Hannah Mastel. Are unvaccinated staff in classroom settings subject to indoor airspace or 6 feet to determine exposure?
My understanding is that it is the shared indoor airspace definition in the school setting. Is that your understanding, Lisa? Is that for schools that are following the group contact tracing model? That's what we've been following since.
Yes, that is what we've been following.
And then
The press release, Kelly, is talking about the general close contact definition. In our quarantine order, we say, we follow the state except for the following exceptions. And then there's many exceptions listed. And one of them is that we follow the K-12 and childcare guidance. And then as well as updating that we are continuing to require quarantine for the unvaccinated. So for the K-12 setting, the K-12 guidance stands.
thank you. At this time, there are no other questions. So if you have them, drop them in the chat so we can get to them. I'll exercise some teacher wait time.
Dr. Locke, also, I'm wondering if you want to just give a general overview of kind of what's happening, similar with the cases, similar to what you did yesterday on the school's call, because I'm not sure everyone on this call was on yesterday's call. Oh, you're muted.
All right. Can you ask that one more time?
Oh, I was just asking if you wanted to give a general sort of status on cases, and just because not everyone on this call was on yesterday's call too. That might be helpful.
Sure. So we are seeing an uptick in cases in Alameda County. It's around 12 per 100,000 per day now. Just to give some context to that our trough after Omicron in mid-March was about 5.5 cases per 100,000 per day. But our peak during Omicron was 265 cases per 100,000 per day. So it's an uptick, but it is a small one. The rise has been very slow and gentle. We're not seeing any, dramatic rise like we did with Omicron. We're monitoring it closely, waiting on some wastewater data from this week, which, the case data always has a 7-day lag. The wastewater data is more of a now data point to look at. So we're waiting on our data points from this week and just watching everything closely. A lot of surrounding counties seem to have plateaued. So it may be that we are at the top of this little mini swell and that's going to be it, or maybe we're not. So we are keeping an eye on it. Our hospitalizations are stable. We're not seeing an increase in hospitalizations, even though we've sort of been on this slow rise for a couple of weeks. Barely anyone in the ICU with COVID. So, it's COVID always keeps us guessing, and we just watch closely. And, if we suspect that we are on a continued rising trajectory, and then there'll be a conversation around a mask mandate, but we're not there yet.
Awesome, thanks. It looks like we've got a few questions that have come in. So from Rebecca Littlejohn, I heard on the news that Cal OSHA has updated their guidance, but their website doesn't look updated. Do you have any update on that?
Yeah, I read that they were meeting yesterday too. There's a they always release their proposed changes with crossouts and additions ahead of the meeting. I haven't heard anything about what happened at the meeting yesterday. But I can try to find that document in the chat because it's a good preview about what they're planning to do. I know that it is extremely confusing now because the county and the state and then OSHA there's guidance that you have to pull from 3 different places now. And I know that that is hard. Let me see if I can find the Cal OSHA version with the crossouts. Give me a minute. Just sent it to somebody the other day. I don't know if you want to talk about something else.
Yeah.
Yeah, I was gonna go to that.
I can go ahead and move on to the next question while you're looking for that. From Rowena Cowan, any update on sport guidance returning to play after testing positive for ACPHD before the athletes needed a doctor's note to clear them before returning to sports?
So that was not a requirement from us. I think that was an American Academy of Pediatrics best practice that was related to the severity of illness. I think a lot of districts and schools may have had that requirement, and I'm not saying you shouldn't have that requirement. I don't know if the Academy has updated its recommendations for returning to play after COVID. I haven't seen anything. Let me see. I can also look at that right now. I did drop the redlined ETS document in the chat as a preview. Again, what they actually did yesterday, I don't know, but often they spend enough time sort of talking about it ahead of time that I don't think many extra changes happen on vote day. So what you see there may be the final changes.
And I just wanted to remind everyone that information about sports guidance is in the K-12 guidance document, which is in the flip book, just as a reminder. And we're completely aligned. Alameda County is totally aligned with that. If you want more information on just general sports guidance or extracurricular guidance.
Right. From next question from Jeannie Curtin. How can the data reflect real-time information as much of the testing is rapid antigen testing at home and not reported? Do you track the various school district website dashboards out of curiosity?
So that's why we look at wastewater data, because wastewater data obviously is unrelated to where you're getting your testing. And so we look at that together with the case rates. The case rates, there still are thousands of PCRs being done in the county. And so it's still helpful to look at trends, but it does not give you accurate absolute numbers anymore. But the wastewater in partnership with it does. So that's why we are sort of eagerly awaiting this week's data point. I'm going to put the American Academy of Pediatrics Return from Sports website in the chat. It looks like they updated their guidance in March. And so that is what I would recommend that districts follow when you're thinking about returning students from sports. I think I need to go through it again because it's been a long time since I looked at this, but it definitely has to do with how ill someone got. Like, I don't think that like asymptomatic students need to be cleared for return. If you have to scroll down a bit to get to the section entitled Evaluation for Resumption of Physical Activity for a Child with COVID. Actually, it says for a child or adolescent who was either asymptomatic or mildly symptomatic, an assessment by a primary care physician is recommended. So that can be just, a parent calling the pediatrician. And then if they are more ill, the pediatrician may want to see them in person. Yeah, there's a nice chart in here. Maybe I can open the chart. Here we go. I can open the chart separately and drop that into the chat, an algorithm.
Thank you. Our last question at this time from Cindy Acker Is the reason that exposed unvaccinated children can continue to attend class because the odds of transmission are low?
The reason that exposed continue in class because, so keep in mind that the guidance has always been and continues to be, although very difficult to enforce, that exposed anybody in the state wear a mask for 10 days after exposure. So this was easy when there was a mask mandate and everyone was masked anyway. Now it's trickier because it would mean that you would have to track who's exposed and returning, and staying in school. But part of the reason is that masks, despite a recent op-ed by some of our friends at UCSF, do actually work. And so part of it is, if you think about layers of protection, you're mixing masking of exposed students with vaccination mixed with ventilation. And all of those things together make keeping kids in school a better choice than excluding them. And I think that the change about where kids were exposed, I don't know if it ever made a ton of sense to say that a student who was exposed at school could stay, but a student who's exposed from home at not. I mean, exposure is exposure. So I'm glad that the state now allows just exposed students in general. But I think working really hard to keep sick kids out of school and making sure that anyone who has symptoms gets tested and then stays home and isolates, and that when kids return from exposure, they should wear a mask and they should test as well. And while that's not a requirement, it certainly is a strong recommendation. And so when you sort of add all of those things together, we, since the mask mandate came off, are not seeing big outbreaks at schools. There was one that came to us as a potential outbreak, but when the investigation happened and the sequencing happened, it turned out that it was actually just a bunch of sort of individual kids that had COVID and all come to school. There was very little in-school spread. So even without the mandate, we're just not seeing it. And that is because of sort of all of the different measures that are in place.
Thank you so much, Dr. Locke. At this time, that is the last of the questions that have been submitted. So we'll give folks just one more minute. Anything else is coming up? Yeah, go ahead, Kelly.
On this topic of classroom teachers, staff really, who, if exposed, will have to quarantine for 5 days. If Cal OSHA did vote to not quarantine exposed workers, the Alameda County Public Health Department with current order trumps that, right? Like, because it's the strictest. So I just wanted to clarify that, because later today we'll find out more about Cal OSHA. I just want to make sure that if that is the case, that we have to stick with our quarantining of, which it's challenging, because if we're using the airspace definition, I mean, you could have teachers, especially with this uptick, we have a number of teachers who are unvaccinated and they could be out of the classroom week after week.
Yep, that is a challenge with not being vaccinated. I mean, if they had COVID during Omicron, remember, you are not required to quarantine if you've had COVID within the last 90 days. So any of your teachers who had it during the Omicron wave would not then need to quarantine again for 90 days. But the ETS automatically aligns with the CDPH guidance. Even like, it takes them a while to do the vote and the updating of the website, but they, because of another order, one of the emergency orders, automatically align when CDPH releases the guidance. So that's actually already in play, except not in Alameda County. So unvaccinated, uninfected within 90 days, staff do have to stay home for 5 days. And it's just, we need to get everyone vaccinated.
Thanks for clarifying.
Thanks, Kelly, and thanks everyone that just added some more questions to the chat, which had a mini wave. From Kathy Marin. How do you report when someone does not tell you of a positive test for 6 days? This happened over spring break.
Do you mean into Spot? Like, how do you?
Yeah.
Okay, Lisa, do you want to?
Yeah, so I was trying to find the language in the state guidance right now to around like when you need to report, but and I'll keep looking for that. I believe that you only need to report cases that were infectious while on campus. So yeah, that's kind of, so if they are back from spring break, you'd have to look at the infectious period, and if they were on campus while infectious, then you would need to report those cases. But if they were, got COVID, were never on campus while infectious, then you would not need to, over break, then you would not need to report that case. This happened a lot over winter break. And that's when we kind of clarified that process. Then you should probably report that case. Sorry, she said they were on campus for a half day while infectious 2 days before the test. So yeah, you would want to report that.
Thank you. From Kelly Mankey. Just to clarify, there's no expectation that students who are symptomatic show the school a negative test to return to school.
Sorry, I was answering another question in the chat. Which question are we on?
Question number 8, just to clarify, there's no expectation that students who are symptomatic show the school a negative test to return to school.
You can handle that however you want. There are, the state released the best practice guidelines for home testing. You might remember in the late fall, it's linked from our testing table. And now I'm trying to remember, I think they list like 3 or 4 best practices, and their statement in the document is if you accept home testing, the recommendation is that you follow one of those best practices. But that is your decision to make. There's no requirement that you do that. If you're not familiar with the table that I'm talking about, we can put it in the chat. It's also linked from the flip book, right, Lisa? The testing table.
Yes, it is.
It's in the flip book. Awesome. Thank you. From Hannah Mestel, a comment request. We would love to have clear public-friendly translations of the press release, Cal OSHA, CDPH, etc. protocols. People push back on us all the time. And if we are having a hard time understanding and finding the right info, we can't expect them to understand it. Fortunately, unfortunately.
Do you mean, we have all of that guidance in the flip book that outlines, like, we've got the FAQs and we've got the flow charts, and like that's what people are supposed to follow. And that's what we can continue to point people to if they're confused, but maybe your question is different.
If I can just come off mute to clarify really quickly, I'm speaking specifically if we had multiple questions about what Alameda County is asking us to do that's different than CDPH, if it were like a single table that says, here's where we differ, because in the press release, it says, we follow CDPH for this, but not for this, and staff in school settings, we're going to treat same as students in school settings, but in other workplaces, we don't. That's what we get a lot of pushback on, and you provide really helpful clarification on these calls, but unfortunately, the staff and parents who then push back on us don't have the privilege of attending these calls. So if there were a simple summary of that information, I appreciate the flip book so tremendously, but that kind of clarification of, staff in school settings are subject to X, Y, and Z that students are subject to, but in the district office, we're doing something else, for example, that's where we need to be able to share the information that you just provided us in a way that they can then understand. So thank you. And it's not meant to knock the very helpful resources in the flipbook. It's that sometimes, if we have to clarify stuff in the press release, it means that we need to be able to then turn around and share that in a way that we can point to. Thanks for letting me come off mute.
Sure. Okay, we can work on that. Thank you for clarifying.
Eric, you're muted.
Thank you so much.
Hey, Eric, you're muted. Okay.
Triples is best if someone else wants to say it too. Thank you from Jeff Pepler. I got to warm up on this question. We've been using shared indoor space for students and 6 feet for staff. Is this still an option? If not, it may greatly affect our staffing as the unvaccinated students can keep coming, but unvaccinated staff cannot. Our unvaccinated staff do a good job of masking and keeping their distance when indoors. This is question 10.
Yeah, I mean, remember, close contact for staff has never been related to masking. I think the modified quarantine was related to masking for students back in the fall, but general close contact is not mask, has never been mask related. Yes, you can. I mean, you can technically use the close contact definition for your students too. It's just that it means you have to individually contact trace. And so that's why the state released their group tracing model in an effort to make it easier so that you could just do a, broad exposure letter now that everyone can stay in school. But if you want to use the 6 feet definition and individually contact trace, yes, you can definitely do that.
Thank you so much. Question number 11 from Susan Davis. I understand that you're not, and you answered this in the chat, but maybe just for folks that are watching. I understand that you're not seeing school outbreaks as a result of lifting the mask mandate, but is it possible the slight uptick we're seeing now is due to lifting the mask mandate?
Yeah, so my answer in the chat was it's really hard to untangle this because a lot of things change at once, including the dominance of BA2 and our Omicron wave to, happen with a mask mandate in place. It would have been much worse had we not had a mask mandate in place. But, masks are not, the perfect solution. It's everything together. And when you look at, the BA2 waves that happened in Europe this spring, some countries went straight from their Omicron wave, their BA1 wave to their BA2 wave. Some didn't, some were big, some were small. And you look at them in the totality and it's really hard to tell why different things are happening in different places. And, New York is on fire right now and we're not, and why? I don't know. I think the virus will continue to target places with low vaccine booster rates. We are very highly vaccine boosted here. But I don't think that there is sort of evidence to support that, this little uptick is related to the loss of the mask mandate. But again, it's really difficult to tell. Because, as I said, Omicron happened with the presence of a mask mandate. So, it would be nice to be able to sort of look back and press a button and be like, oh, that's why that happened. But, we just keep looking back in time as we look forward and sort of trying to apply lessons learned. And as the virus changes, outcomes change and we try to change with it in real time, but it is tricky.
Thank you, Dr. Locke. Susan says super helpful. That will help us answer questions from families and staff. Question number 12 from Rebecca Littlejohn. For my clarity, if a positive student came to school and attended 7 class periods for 45 minutes each, then each of those teachers were exposed. And if they are all unvaccinated, they would need to quarantine, correct?
Yeah, that's correct. I mean, you can, if you want to apply the individual contact tracing, you know, the stricter close contact definition of, you know, 6 feet. I guess it's the less, it covers fewer people. If you use the 6 feet definition, you can do that. So if the positive student was sitting, you know, in the back of the class, you know, technically, if you wanted to apply the 6 feet definition, then none of those teachers were exposed. I mean, obviously, the virus cares not what our definition is. And if you're talking about a classroom with poor airflow, you know, the particles will be in the front of the class next to the teacher. So you have to, you know, think about it both from a definition perspective and sort of a reality of what is going on in that school and what the ventilation is like and other factors, whether or not you actually think there's a high risk of exposure, even if the affected student was in the back and the teacher's in the front. And Rebecca, feel free to come off mute if I just made it less clear for you.
I think you did all right. Oh, very clear. Thanks. All right, that was the last question that we have from the chat. All right, anything else then, Dr. Locke or Lisa, that you would like to add for our COVID liaisons while we're all here together?
I hope you all are looking forward to the end of school and getting maybe a little break around having to constantly think about this. Although I imagine a lot of you are running summer school or will be involved in summer school. But you know, all of you have done such an amazing job this year. This has been an ask like no other. And we so appreciate your partnership and your sort of willingness to accept, you know, answers that sometimes are less than clear and work with us in the gray area, and keep coming back to these calls and keep coming back to your job every day to try to, you know, make schools as safe as possible. And I really hope, you know, next year is a little bit more straightforward, but you just never know. So thank you all for all of your work. We so appreciate it. I don't know, you know, there's no way we can do this alone. We need your partnership. So thank you.
Absolutely. And with that, Dr. Locke, you get a few more questions. Keep coming, which is great. But I think they're going to be quick. From Exia Sykes, there's been an increase in COVID cases each time a mask mandate has lessened restrictions. What is the lesson learned in the decision process?
I mean, there have also been increases in cases with mask mandates like Omicron. So, you know, Delta was going to blow through and Omicron was going to blow through no matter what the mask mandate is. You know, the mask mandate helps to dampen the waves. It does not get rid of them. You know, health officer orders are meant to be used for, you know, emergent situations, right? It's a legal order. You have to think about, I mean, isolation and quarantine orders, you know, normally those are delivered, you know, to an individual person related to an individual infectious disease. This sort of blanket orders covering a population, while appropriate to COVID, is, you know, that's not sort of standard operating procedure for a health officer. And so it's important to use those orders sparingly. So we know that masks are effective in blunting surges. They're most effective when you implement them on the upswing, but they can't stay in place forever. I mean, we can't have, you know, we have bad flu years and there's no mask mandate imposed. So, you know, it's balancing the need for a legal order versus recommendations. And there's still a strong recommendation for masking in Alameda County, right? I still wear a mask when I go to the grocery store. People are still free to send their kids to school in masks, and many do. So we have to sort of separate the legal requirement from the recommendation, which is normally how public health works, right? Like we make recommendations. So there's still a strong recommendation for masking, and we will save the legal orders for, you know, times when we really think we're heading into a big wave. So, you know, and again, even with Omicron, masking, state mandate in place, local mandate in place. There was just, I mean, everything was so, you know, trying to be so tight about everything. We still had this enormous wave because the virus is highly infectious. But, you know, it's the combination of all of these things: vaccination, boosting, masking, quarantine, isolation. It's everything in partnership together. And so, you know, we just need to, going forward, sort of separate the recommendation from the legal and save the legal for, you know, when we head into a big winter wave, which we probably will, you can expect there will be a mandate again. Hopefully that helps.
Yeah. Thank you for all the context around that. We've got one last question, just to clarify. So unvaccinated teachers quarantine, but not unvaccinated children.
That's right. Some schools and childcare centers still require home quarantine for exposed students. That's not something that we sort of promote because, you know, we really want kids to be in school. They've undergone a lot, as have staff, the last 2 years. So right now, state guidance allows unvaccinated exposed students to attend school. State guidance allows unvaccinated others, but our local order doesn't. So teachers stay home, students can attend school. But there are schools that have more restrictions on what exposed students can do than the state allows.
Thank you. From Popador, you are all amazing. Thank you so much for all you do. For staff in school settings, does ACPHD have specific guidance for return to work for close contacts versus quarantine guidance for their personal lives? Do we follow current ETS guidance of testing 3 to 5 days and not excluding asymptomatic close contacts?
So the ETS right now, the table that you may be referring to has not been updated to align with the state changes, but for some time, the ETS, so it used to be that if you were about booster eligible but unboosted, you were supposed to quarantine. And then the ETS allowed that group. So you're fully vaccinated, booster eligible, but unboosted. That group could leave quarantine to return to work and then be in quarantine in their personal life. That has gone away from the state's perspective. So if you don't have to quarantine unless you're in specific high-risk settings like, you know, long-term care facilities and correctional facilities. You don't have, according to the state, no one has to quarantine anymore when exposed if asymptomatic. Our order requires it of unvaccinated. If you are fully vaccinated but unboosted, you can still return to work. So we're not distinguishing in our order between sort of leaving work and then quarantine. If you're unvaccinated, you quarantine for 5 days. That includes work. And if you are fully vaccinated, booster, no booster, you do not have to quarantine. And then of course, if you've been ill within the last 90 days with COVID, you don't have to quarantine. So I think the revisions to ETS will make that a little bit less confusing, and they're going to, you know, they automatically align with the new state guidance that no longer distinguishes between boosted and unboosted. So right now, unfortunately, you have pieces of your guidance coming from 3 different spots. And when the ETS sort of updates its materials, hopefully it will be a little bit clearer. And then we, on a weekly basis, are reviewing our quarantine order to see when it is appropriate for us to align with the state, which at some point we will. There's no deadline. It's just we review Monday of every week. Is this the week? Is it not the week? So I imagine that at some point in the not too distant future, we will be aligning fully with the state, which I know will make their lives a lot easier.
Thank you so much. With that, we have no more questions. So we can go ahead and wrap up 10 minutes early. Just want to echo again, Dr. Locke's statements. You're all amazing. Thank you so much for the work that you're doing for the schools. Can't imagine doing it myself.
Eric, thank you so much for facilitating today too, because
I-
Michelle and Ruth were out, but you did awesome. Thank you. Appreciate it.
Yeah, thank you, Lisa. It's my pleasure. Happy to support any way I can. Like I said, we'll get this recording out hopefully by end of day on Monday, so you can pass it around to anyone else that needs to see it. And with that, have a wonderful, restful weekend, and we will see you next month.
Bye, everyone. Have a good weekend.
Bye.
Bye.